Okay, now in this lecture, this portion, we will talk about some anatomical reference terminology and major landmarks. We'll talk about some anatomical regions and directional terms. So it's really important to understand some of the main body parts to understand when we get into muscles and bones. You're going to hear a muscle called the buccinator muscle. And when you hear buccinator, it's going to hint that it has to be somewhere near the cheek. Okay? You're going to hear of a bone called the frontal bone. So that's important to know that this area is called the frontal. You're going to hear of a muscle called the frontalis. You're going to hear of a muscle called the temporalis. So here, this area is called the temporal region. I'll put a T there for temporal. The chin is called mental. When we do osteology, there's going to be a hole here and a hole here. And everywhere we see holes, they're called foramen. They happen to be called mental foramen. The mouth is called oral. The ear is called otic. The eye is called ocular or orbital. And the nose is called nasal. The skull is called cranial. The face is called facial. When we combine both the cranium and the facial, they use the term cephalic. Cephalic means head. My wife happens to be from a Greek island called Cephalonia. Cephalonia means the head Greek island, the head island. The armpit is called the axillary region. So when we do osteology and we learn the scapula, there's a part of the scapula called the axillary border. Then there's an axillary artery and an axillary vein. There's a brachial artery and a brachial vein. There are cervical vertebrae. There are thoracic vertebrae. Then we have mammary ducts of the breast. We have abdominal muscles. The belly button is called the umbilical, and all of these together are referred to as the trunk. So this would be on a type of quiz, sometimes on a quiz or an exam where it's like a drag and drop. So all these answers may be off to the side, and you would drag frontal here, because this is the frontal region. The eye is the orbital. The nose is the nasal. The chin is the mental. The cheek is buccal. Ear is otic. Here is the anterior triangle. And then here is a lateral triangle. Anterior is in front. Lateral means it's to the outside. Okay, let's look at the lower part. Well, the wrist, you've heard of carpal tunnel syndrome. So carpal is wrist, not to be confused with the ankle, which is tarsal. So you have carpals and tarsals. Just think tarsal with a T for toes. Right? So the tarsals are with the toes are, which is the feet. The great toe is called the hallux, whereas the thumb is called the pollex. The digits of both the hand and the digits of the feet are both referred to as phalangeal or phalange. Phalangeal. Here is the groin, which is known as the inguinal area. So this is actually called the inguinal ligament here. Then there's a bone called the pubic bone. This part of the thigh here is the femoral, the longest bone in the body. The foot is called pedal, looks like pedal. Well, that's an easy way to remember it, pedaling a bike with your foot. Okay? The palm is called palmar. Whereas the bottom of the foot, it's not showing it here, but the bottom of the foot is called plantar. So the plantar surface of the foot is the underneath surface. The plantar surface is here on the bottom, like the sole of the foot. Again, cephalic means head, cervical means neck, This is your upper limb. The elbow is called the olecranon or olecranol. That's the part of the elbow you lean on. The highest point of the shoulder is called the acromial or acromial process. And the back is called dorsal. The front is called ventral, but the back is called dorsal, much like the dorsal fin of a dolphin or a shark. It's on the back. When we look at the lower limb, the rump here is the gluteal region. We will be learning about muscles like the gluteus medius, maximus, and gluteus minimus. The back of the knee is called the popliteal. When you do blood vessels, there's a popliteal artery, vein, and nerve back here. The calf is called sural. The heel is called calcaneal. A lot of runners get calcaneal heel spurs. And then the bottom of the foot, or the sole of the foot, is called the plantar surface. When we talk of directional terms, superior, inferior, anterior, posterior, median, lateral. So superior and inferior, these are opposites. Anterior and posterior opposites, medial and lateral are opposites. So anterior is the front of the body, posterior is the back of the body. Medial is what midline is, and when you start moving away from midline, you're moving lateral. Superior is towards the head, inferior is down below. Proximal and distal are opposites. Superior and deep are opposites. Contralateral and ipsilateral are opposites. Let's take a look on picture. So if proximal and distal is similar to superior and inferior, the difference is superior and inferior are in relationship to the entire body. Right, superior is moving up, inferior is moving down. But if you look at proximal, it moves up, and distal, the arrow moves down. When we're talking about parts of the body or extremities, we use proximal and distal. So if I'm starting here at the acromion and I'm moving down to the elbow, I'm moving distal. If I go from the elbow and I move to the carpals, I'm moving distal. But if I'm starting at the carpals and I move up to the acromion process, I move proximally. Okay? If I start at the feet and I move up to the head, I move superiorly, because that's in relationship to the whole body. Medial and lateral. Medial is midline. When you move away from it, you're moving laterally. So the pinky is the most medial, not middle, but medial finger, and as I move lateral to it, I can find the thumb. My nose is medial, my ears are lateral to it. Okay, what else did we have here? Superficial and deep. Okay, the skin, the epidermis is superficial, the dermis is deep. And contralateral and ipsilateral. Patient came in with right shoulder pain and ipsilateral wrist pain. It means on the same side. Patient came in with right wrist pain and contralateral ankle pain. It means right wrist, but left or opposite ankle. Again, superior and inferior relate to the entire body. Here's a great picture for anterior and posterior, aka ventral and dorsal. Anterior is the front, posterior is the back. Another way of saying anterior is ventral, another way of saying posterior is dorsal. Moving cranially is towards the skull, moving caudally is to the sacrum. Okay, let's take a break here.